Welcome to this Medicare 101 workshop. Let's get two things out of the way right off the bat so that we're both on the same page here. Allow me to clarify what this is and what this is not. This is an educational video that will go over how the Medicare system works for you. You will learn the basics of Medicare and how a bunch of different parts all work together to cover specific areas of healthcare once you go on Medicare. If you're getting closer to needing Medicare, this will help you understand the choices that you have. If you're already on Medicare, this should be a nice refresher on how it all works. Let's talk about what this is not. This is not a sales presentation. I am not here to sell you on any plan or direction or anything when it comes to which Medicare plan you should get. I will go over how different types of plans work. However, this is not plan specific, meaning I'm not going to go over plan details for a particular Advantage plan from XYZ insurance company in a certain part of the country or a specific supplement plan from a specific insurance company. There are too many variables to bring up specific plans, especially given the fact that you could be watching this from anywhere in the country, and plans are often zip code specific. So if you're looking for a sales video for a specific insurance company's plan, I'll save you the time and warn you that this is not the video for you. The last thing that this is not is a deep dive into fringe case examples. I'm not trying to cover every possible angle that could ever happen, which I promise would lead to more confusion. What I will cover goes over what most people experience, but there are several exceptions in the world of Medicare. Once you get the basics from this video, I'd recommend our YouTube channel 90 Days from Retirement. That tackles specific topics in much more detail. Now that we have that out of the way, believe it or not, I think we're actually going to have a little bit of fun here today, so let me share some screens with you. We're going to treat this like your favorite Netflix series rebranded as Medflix. There are 4 different episodes in this series. You can binge watch all 4 at once, you can watch a specific episode and come back to others later, or you can skip to different episodes as you please. So with that, let's get started with episode 1. Episode 1 will go over original Medicare, how it started, the 2 parts, part A and B, and the gaps that original Medicare does not cover. Original Medicare's origin story began back on July 30th, 1965, when then President Lyndon B. Johnson, the one with the pen, signed Medicare into law. The first ever Medicare recipient was former President Harry S. Truman, there on the right. Here's a picture of former President Truman's Medicare card. 2 interesting pieces of information on this card would be that Medicare numbers used to be your Social Security number, and we can see President Truman's Social Security number here. It wasn't until 2018 that everyone realized that having the Social Security number on there wasn't the best decision, so they changed the Medicare number to a randomized number that you will see in a minute. Also, back in 1965, Medicare Part B cost a whopping $3 per month. We will cover what it costs today, and unfortunately, it is much higher than $3. As promised, here is what the Medicare card looks like today. This card is just paper. It isn't anything super durable, so if you want to laminate it or get a protective sleeve, you can. They will also send you replacements for free if you need them to. The Medicare number is now an alphanumeric set of digits, and if you notice here, Medicare coverage always starts on the first day of a month. We will cover several Medicare timelines in various episodes along the way. This all sounds well and good, but the question becomes, how do you get Medicare? Because not everyone qualifies for it. In fact, there are only 4 ways to get it. The first is the most well-known and most common, and that is by turning 65 years old. The second is through a disability. Once you've been disabled for 24 consecutive months and you're receiving Social Security Disability Insurance, or SSDI, you qualify for Medicare. The third is for those diagnosed with end-stage renal disease, or ESRD, also known as kidney failure. And the last way to qualify is for those diagnosed with amyotrophic lateral sclerosis, more commonly referred to as ALS or Lou Gehrig's disease. Those are the only 4 ways to qualify. Okay, so you qualify for Medicare. What do you get out of it exactly? Moving forward, it's important to emphasize that Medicare is an individual plan. If you have a spouse, each of you will have your own plans, your own premiums, your own deductibles, copays, and coinsurance amounts. So for all of the coverage and numbers moving forward, if you have a spouse, apply these numbers to each of you, not both of you combined. When the Medicare legislation was written, it had 2 parts, Part A and Part B. Let's talk about Part A first. Part A is your hospital coverage, meaning it will cover your stay as an inpatient in the hospital. The easiest way to think of this is it is your rent to stay in the hospital, room and board, if you will. But Part A actually covers 3 other areas of healthcare as well. It covers skilled nursing facility care. This is not nursing homes. Think of this as rehab, where you go in, you get better, and you go home. Part A covers some home health care after you've had an inpatient stay in the hospital. And finally, Part A covers hospice care. This is palliative care, meaning end-of-life care where a terminal diagnosis is involved. That's what it covers, so what is it going to cost you to have this? The good news is that for most people, Part A doesn't cost you anything. And by most people, the Centers for Medicare and Medicaid Services, or CMS, which is the governing body of Medicare, puts it at about 99% of people do not have Part A costs. Part A is where your payroll taxes are going. In order for this to happen, you must have worked and contributed to the Medicare system through your FICA taxes for at least 40 quarters. Now, there are 4 quarters to a year, so 10 years. These do not need to be 10 consecutive years, just 10 years total throughout your life. If you are married and your spouse is at least 62 years old, you can also qualify on your spouse's work history. So for those who didn't work because they were at home or any other reasons, you are okay as long as your spouse worked for 40 quarters. If you fall into the 1% of folks who do not qualify for no-cost Part A, you can see that there are different monthly costs depending on how many quarters of work you have. All right, we need to talk about the gaps or things that Part A does not cover that would require you to spend your own money. The first is the deductible. You are likely familiar with what a deductible is because many insurance plans you've had in the past have them. A deductible is a dollar amount that you need to pay first before insurance, or in this case Medicare, will start paying anything to help. Part A's deductible this year is here, and you'll notice that it is a per benefit period deductible. This can get a little bit confusing, so let's clear it up. Most deductibles you've had are annual deductibles. Once you meet that number, it resets the next year. Not the case with the Part A deductible. There is a benefit period that begins when you are admitted into the hospital as an inpatient, and then the benefit period ends when you have been out of the hospital for 60 consecutive days. For example, you go in the hospital on January 1st, you're there for 3 days, and you're released on January 4th. You go about your life, and then say on April 1st something happens and you go back into the hospital. Well, it's been more than 60 days since you were released from the first visit, so you're in a new benefit period, and you have to pay this deductible again. The point is you could have multiple Part A deductibles in a year if you have multiple inpatient hospital visits spaced out throughout the year. But wait, that's not the only hole in Part A. You also have copays with Part A. The first copay is around your hospital stay. That deductible that we just talked about covers your first 60 days in the hospital. Remember, the benefit we were talking about talks about days out of the hospital. Now we're talking about days in the hospital. If you're in the hospital for more than 60 days, you have a copay. And if you're in the hospital for more than 90 days, you have a higher copay. Days 90 through 150 are actually called lifetime reserve days, and once you use them, you lose them. After day 150, or if you have used your lifetime reserve days and have another 91 plus day stay in the hospital, you're responsible for 100% of the costs at that point, and those are daily copay amounts. All right, we have one more Part A gap to cover, and it is another copay, and it has to do with skilled nursing facilities. Part A does a great job of covering the first 20 days in a skilled nursing facility. In fact, it covers the first 20 days 100% after you've met that deductible. But for days 21 through 100, you have a daily copay. And then for days 100 plus, you are responsible for 100% of the cost. Okay, we made it through Part A, your hospital coverage. Let's go over the other part of Original Medicare, which is Medicare Part B. Part B is your medical coverage. So Part B covers doctor services. It covers outpatient care, things like labs and x-rays and therapies like physical, occupational, and chemotherapy. So what does Part B cost? Unlike Part A, Part B does have a cost. And for most people, it's right here. This is a per person, per month premium. Again, Medicare is an individual plan. So if you have a spouse, each of you pay that premium once you are on Medicare. I say most people pay this amount because it is dependent on your income. Those who are low income, think Medicaid, can have this adjusted down or have it go away completely. Those with higher incomes could pay more. In fact, here are the income brackets and how much you would pay. Your income levels will depend on whether you file taxes individually or jointly with a spouse. Your income number is taken from your tax return 2 years prior. So if you were going on Medicare today, you would use your tax return from 2 years ago. Then the next year they would do a 2-year look back again. So this is a moving number. You're not locked into this premium amount based on potentially your highest earning years from 2 years before you started Medicare. You can appeal this number to get it lowered for several reasons, including a reduction in income due to work stoppage. So that's something that you'll want to sit down with someone and discuss once the time comes. I keep repeating this because it is important, but these premium numbers are per person. And if one spouse makes a bunch of money and the other makes little or none, but you file jointly, both spouses have the higher amount. All right, Part B is voluntary. You don't have to get it, but if you don't get it when you should, and then you try to get it later, you could have a penalty, and that penalty stays with you for your entire life. That penalty is 10% higher premiums for every year you decide not to get Part B when you should. This penalty would apply if you are eligible for Medicare, think 65, and you decide not to get Part B, and either you have no health insurance, you're covered by an individual health plan through the marketplace, you're covered by COBRA insurance, or you're covered by a retiree health plan. If any of those apply to you and you turn 65 and decide not to take Part B, you could have a penalty waiting for you once you do go on Part B. This causes an unfortunate rumor to spread across the country that everyone has to get Medicare when they turn 65. This is not the case. There are two very important exceptions to this penalty that apply to a lot of people. Number one, if you are employed and you are covered by your company insurance plan through work, you do not have to get Medicare. You will not be penalized for not taking Medicare at 65. You can postpone until you're 100 if you want, as long as you're still working and covered by the company group plan. Once you decide to retire, let's say it's at 67, you would have a special enrollment period where you could pick up Medicare with no penalties, and we'll talk about that period here a bit later. The second exception, if your spouse is working and you are covered by your spouse's company group plan, you do not have to get Medicare at 65. You can wait, just like the previous example, until your spouse retires and you are no longer covered by his or her plan, and then move to Medicare without penalties. As with many things in life, there are exceptions to these exceptions. Things get a little bit weird if your company or your spouse's company has fewer than 20 employees, so 19 or less. If this is the case, you still don't have to go on Medicare and you won't have a penalty. However, a who pays first problem arises. Normally for groups with 20 or more employees, the company plan pays the bill first and anything left over goes to Medicare. But for companies with fewer than 20 employees, Medicare is actually the primary payer and the company plan is secondary. So if you work for a company with fewer than 20 employees, you are eligible for Medicare, think 65, but you don't have Medicare and you get a healthcare bill, that bill is sent to your company insurance plan. The insurance company will look at you and see that you are eligible for Medicare and that Medicare didn't pay first, and that company insurance plan can say, nope, we won't pay anything until Medicare does first, at which point you are now responsible for the full cost of that bill. So this is an important consideration if you work for a company with fewer than 20 employees. All right, let's talk about the gaps that Part B does not cover. Like Part A, there is a deductible. Unlike Part A, this is an annual deductible, meaning once you meet it, you don't have to worry about it again until the next year. This deductible is actually quite reasonable. The second Part B gap would be a 20% coinsurance. Medicare Part B covers 80% of any approved Part B expense. You are responsible for the other 20%. The scary part, there is no maximum on that number. Most plans you've had will have a maximum out of pocket. Not the case with Part B. If you get a $1 million Part B cancer claim as an example, you would be responsible for 20% or $200,000. So those are the gaps of original Medicare. While we're at it, let's talk about a few other things that Medicare does not cover. Notice the nice rolling hills in this picture? This is because the next four gaps are quite manageable, and I'll explain why. Medicare does not cover prescription medications, dental, vision, or hearing. A lot of people think these are included. They are not. These are manageable because there are either standalone plans that you can pick for each of these that are relatively low in monthly premiums, or these coverages often come included in a Medicare Advantage plan that is in episode 2. The next gaps are a bit more intimidating. Notice that the calm rolling hills have been replaced by a cliff. Long-term care is what people usually associate with things like nursing homes, dementia facilities, Alzheimer's, or home health care. Medicare does not touch long-term care. This is an area that can wipe out assets because it is very expensive and it's only getting worse. Original Medicare does not touch care outside the U.S. Original Medicare does not cover excess charges. This happens when you visit a facility or a provider that does not participate with Medicare or has opted out of Medicare. Finally, unapproved charges are not covered by Medicare. Think cosmetic surgeries, experimental procedures, or services not approved by Medicare are not covered by Medicare. So I've just spent several minutes telling you all about what Medicare does not cover. It can be quite scary, and look, I'll unapologetically admit that this is a bit of a cliffhanger because while you may have a lot of worry around all of these holes, asking yourself, how will I survive once I move to Medicare? We cover that in episode 2.